Hello, and welcome to NANN-Cast. I'm Jill, your host. As the professional voice of neonatal APRNs, the National Association of Neonatal Nurses Advanced Practice, or NANN-AP, has developed several policy statements on neonatal advanced practice registered nurse workforce, education, competency, fatigue, quality and safety, and scope of practice. NANN has recently released the APRN Scope of Practice position paper, which is an updated synthesis of the previous and current efforts and discusses the role, preparation, and scope of practice of the neonatal APRN and those caring for patients in the neonatal population. NANN-AP believes that all providers who practice in the NICU should have completed a neonatal population-specific educational program and achieved national neonatal population-specific certification. How can APRNs utilize this position statement in their NICU? Joining me today to help answer those questions is Dr. Suzanne Stabler, co-author of this position statement. Let's get right into it. Thank you, Suzanne, for joining us today. We all know that NANN and NANN-AP are committed to supporting neonatal nurses across the neonatal career continuum and address the unique workforce and professional issues that we face every day. What drove you to focus on the scope of practice of the advanced practice nurse?
Well, Jill, this is actually a revision of the original 2014 paper. And through my work with the LACE task force as the national NP representative, it became clear that we needed to update the paper, so that it was more contemporary with some of the practice issues facing APRNs today, as well as the fact that we have a whole nother set of issues that we're dealing with in our everyday practice that needed to be addressed.
So we all know that the healthcare environment and the workforce environment has evolved greatly since 2014 when you first published this position statement. And we have been seeing a lot of alternative providers coming into the NICU. Can you explain some of those different roles that we're seeing?
Sure. I'd like to start with talking about the fact that the neonatal nurse practitioner was the very first nurse practitioner, acute care nurse practitioner in the United States. And our role dates back to the late 1970s. We are one of the only acute care nurse practitioners that has data to back up our cost effectiveness and the care that we give to our patients.
So, Suzanne, what is NANN and NANN-AP's position on DNP as entry into advanced practice?
Wow, that's a can of worms, Jill. NANN and NANN-AP do not endorse the DNP as an entry into practice. Now, they absolutely endorse the DNP as a terminal degree for advanced practice nursing and for those in leadership or directorship positions in a neonatal intensive care unit. But the organization has several different priorities that really make endorsing the DNP counterintuitive. One of our priorities is increasing workforce. So increasing workforce at the master's level is shorter and more cost effective, which also enables us to put more diverse providers into the workforce to help diversify the NNP and CNS workforce. And so the DNP is a longer course of study. And at this point in time, there is no data to support that the outcomes of care by a DNP prepared provider are different or better than that of an MSN prepared provider. And so when you don't have data to support something and you're trying to increase workforce and increase diversity, you don't want to increase costs and increase the length of study. And so NANN very thoughtfully put together their position statement. There is a position statement on the website about the DNP as entry into advanced practice. And that is not something that we are endorsing at this time. Unfortunately, what happens is NICU nurses decide to go back to school and they don't want to be an NNP when they go back to school, so they choose another NP role, but yet when they get in school, they realize they really don't like that either. So they come out of school with a primary care focus or a pediatric or family focus and then want to go back into the NICU. But their RN experience does not expand their role as an APRN. And so a family nurse practitioner or a primary care pediatric nurse practitioner really does not have a role with neonates unless they are term newborns with no issues. And so there are other roles, such as the neonatal PA, or really I should say just PA, who really in their course of education and in their certification process have very minimal neonatal content. When you look at the education standards of a PA, they have in the vicinity of an hour, maybe two, talking through all aspects of neonatology. And so their training is not at all in depth. And what training they do get is really more on the job training, and there's no standards, there's no national standards looking at neonatal fellowship programs. How long should they be? What content should be included? There's no accreditation standards for those fellowships, and there's no national certification exam in the population of neonatology to assess and validate their knowledge competency in the population. The other role we haven't really talked about, Jill, is the neonatal CNS. And that role, although it's been around as long as the neonatal NP role, there aren't a whole lot of people in that role. And yet it's a very crucial role. It's a very vital role, to the point that the American Academy of Pediatrics has included that role in their new level of care designation program for level 3 and level 4 NICUs.
I thought it was interesting you mentioned how new graduates of a neonatal nurse practitioner program often find themselves in the CNS role. But in your position statement, it talks in depth about the distinct role that a CNS has and the importance of a very honed in education program for that role.
Yeah, the roles are totally different. So we as neonatal nurse practitioners are really educated to be the primary care provider for a patient. So we work with the neonatologist to do medical management. That is a very distinct role from a CNS, which really is more population-based, focused. And the CNS has 3 spheres of influence: the nurse, the patient, and then the healthcare system. And so the CNS impacts care through education, through competency validation, through monitoring of outcomes, through systems change and management. And those are things that NNP programs at the master's level certainly don't really touch on. At the DNP level, many of those things overlap with DNP curriculum, but it really isn't part of the role. The competencies of a CNS and the competencies of a nurse practitioner in the neonatal population are very distinct and different. And so NNPs really should not be functioning in a CNS role. And in many states, they absolutely cannot use the title of CNS because it's a protected title in 47 states. And so to represent yourself as a CNS when you really are an NP can have repercussions on your license.
As you mentioned, that CNSs, especially in the neonatal role, are very few and far between, but we all understand the importance of their role in our NICU. I can't tell you how much, as a provider, as a nurse, we rely on the CNSs for everything. What kinds of educational standards or competencies are needed to be a CNS? And are they being followed or are they being developed?
Currently, Jill, the National Association for Clinical Nurse Specialists has global CNS competencies and education standards, but they are global. And then programs are supposed to take those global CNSs and then develop the population specific competencies. And that is something that NANN had been working on in the past, but has yet to define. And that is something that is really needed. And hopefully, the CNSs who listen to this podcast will get involved in the association for that very important work to happen. So we need neonatal education standards as well as neonatal CNS competencies to be developed, because those serve as the roadmap then for educational programs. And so it makes it easier then for colleges of nursing to develop those programs if they have the population specifics laid out for them. We really need to pay attention, because we have a lot of people who say they're CNSs, but when you look at certification numbers, there's only about 100 who are actively certified in the United States. Now, some states recognize people who were educated prior to certification being mandatory, but many states do not. And so, for title protection reasons and for the advancement of the role and for better patient care, CNSs really need to be educated and trained as a neonatal CNS, and they need to be certified.
So everybody join the NANN-AP Council and try to get your voices heard and help develop this really important educational standards and competencies, so we can make sure that this position thrives and we can really affect the outcomes of our patients and our families too. We've talked about the CNS role and scope of practice in the NICUs, but let's dive deeper into the neonatal nurse practitioner role. What are some of the key takeaways from the position statement?
I think one of the most important takeaways from the position statement, Jill, is the fact that there are now almost 7,500 certified NNPs in the United States, but that makes up less than 2% of the US NP population. And when you look at workforce demands, we probably need at least twice that many for a couple of different reasons. ACGME pediatric residency standards continue to evolve and continue to decrease the number of hours that pediatric residents are exposed in the NICU. And secondly, because the NNP role is the oldest acute care role in the US, many of those early adopters who began practice in the late 70s and early 1980s are now ready to retire. And so we are anticipating somewhere between 20 to 25% of our current workforce retiring in the next 3 to 5 years. And so schools of nursing could double their capacity for NNP programs and still not meet the workforce demand.
And this is why this position statement is so important and timely, because we are starting to see those gaps of not having enough providers, neonatal nurse practitioners, being filled with alternative providers. And there's a lot of confusion amongst that. So this is an excellent position statement for everybody to read and to become familiar with, so you can understand what each role is and what their scope of practice is, as far as what kind of educational standards and competencies that they had to meet in order to graduate in that role.
Yes, that's very important, Jill, because the scope of practice for any APRN is really defined by their education, training, and competencies that are established by their population specific organization, the National Organization of Nurse Practitioner Faculty documents for core competencies of the NP, as well as the AACN Essentials. And all of this is kind of then encapsulated with the Nurse or Nursing Practice Act and the rules and regulations of each state and jurisdiction. And so, again, to reiterate, it's important to remember that an APRN scope of practice is not expanded by their previous RN experience or their postgraduate fellowship training. And so some of the key highlights in the paper, toward the end of the paper, was a table comparing different advanced practice providers' educational curriculum, their competency standards, as well as their certification criteria. And we put this in the paper to help guide hiring decisions so that the right provider is caring for the right types of neonatal patients based on their education, training, and certification.
I'm glad NANN included this table in the position statement because it's a very good tool to bring to your manager, any kind of leadership that you're talking to regarding staffing of your unit, figuring out roles and scope of practice, because it's right there. It's comparing every kind of role that would be included in the NICU, whether it's a family nurse practitioner, pediatric nurse practitioner, a neonatal nurse practitioner, or a PA that would be in your unit.
Absolutely, Jill. It was a labor of love for those of us who worked on the paper, but we really felt like our patients deserve the best provider, one who is educated and trained in the neonatal specialty and who through their national board certification can demonstrate that knowledge, competency, and continued competency through the maintenance of certification programs. Our physician colleagues have a very similar process. And so it's really important to remember that APRNs are not educated as our physician colleagues are, that we have a very specific population focus. And in pediatrics and adults, we're even further focused in primary care versus acute care. And so it's really important to understand how each provider is educated, trained, and certified, so that way our patients are getting the best possible care.
Exactly. And I think a lot of this table also brings to light how different providers are utilized in the NICU, because it's very specific as to what their role should be. So it's very well defined. So it would be an excellent tool, again, for making hiring decisions as well, because you can see what their training is, what their certification is, and what types of neonatal scope of practice that they could possibly be caring for.
Correct.
Well, thank you, Suzanne, for all of your hard work and dedication to the APRN role and providing us with this excellent paper and tool that we can make sure that we're looking beyond our NICU staffing needs, but also making sure that we have safe practice and providing care for our babies to get the best outcomes possible. Head over to NANN.org to locate the APRN Scope of Practice Position Statement. There, you'll also find the table on APP Educational, Curriculum, Competency, and Certification Criteria. Make sure you never miss an episode of NANNcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.